meetings. So to listen on this topic, I would like to invite Professor Dr. Anirban Home Choudhury from Delhi, who is a departmental head of critical care from GB Pant Hospital. And to chair this particular session, I would like to invite President HTS, endocrinologist Dr. Sanjay Keshav, Dr. Achoba Singh, who is an endocrinologist from Imphal, Dr. BP Pandey, Secretary HTS, and a very well-known cardiologist. So I welcome the speaker and the chairpersons to chair this particular session, which goes as Artificial Intelligence in Healthcare.
Should I start? Good morning, everyone. First of all, let me just give my gratitude to the organizers of Howrah Town Diabetes Study Society for inviting me for this session. Thank you. And for this session, I think I need not again introduce the speaker. It's already been discussed. As you all know, this is a new topic and it will be quite interesting. Artificial technologies in the field of medicine. So for this, Dr. Anirban Tom Choudhury will be speaking and enlighten us. So I invite Dr. Anirban Choudhury for the session. Please go ahead.
Thank you, sir. At the very onset, I wish to thank Dr. Mridul Bera, Dr. Guru Prasad, and all the eminent members of Howrah Town Diabetic Society for inviting me and giving me this opportunity to participate in this wonderful conference. And my sincere thanks goes to them for their warm hospitality. Artificial intelligence, as we all know, is something on which we are worried as much as very not so conscious, but we are fearsome too, for the simple reason that its limits and extents are not guided by our human mind, it is guided by the artificial mind. So, I am not an expert of artificial intelligence, and the reason why I have been chosen for this topic is probably because we have designed a process which has been patented by the government of Australia as in artificial intelligence for hemodynamic monitoring in sick patients in the ICU. But to think for that I am expert in artificial intelligence would become a natural stupidity, so I won't delve into that. So I will try to restrict to things that I have understood, things what we did in the course of this research, and the ways as a clinician we can take help from AI to improve our clinical practice and to take guidance in pursuing those areas which are relatively new. So it all started long back. It was in 1950 when people started asking this question that how to know that whether the machine is intelligent. And that artificial intelligence, the concept emanated, trying to think that if something is intelligence, its quality will be at par with the human thinking. So Alan Turing gave this test, which is a standard test in artificial intelligence, to any machine when an operator is guarded off from two sources, one of which is human and another is the machine. And it is a text-based questionnaire he circulates to both of them and gets the responses. If he is unable to distinguish between who is human and who is machine, then the machine is considered as the artificial intelligence. But when we see artificial intelligence in the light of its further developments, we understand that it's a broad area of computer science which deals with big data and tries to bring out all the inferences. There are only two things that artificial intelligence tries to speak about. That is one, prediction, and number 2, inference. And these two in a much broader and a bigger manner. So there are certain areas which overlap to shape it up, and one of which, and each of which they have a circle, so you can see that they encompass each other to a varying degree. Whenever we talk about data science, we mean it is a multidisciplinary field where we have structured data, unstructured data, raw data, processed data, and from that data, actually the inputs come to the artificial intelligence. So artificial intelligence is, again, includes two more things. One is machine learning and deep learning. So artificial intelligence that we see today in healthcare, in diabetes, in critical care, in oncology, in cardiology, is all centered around these two things, either machine learning or deep learning. Machine learning is the process of getting machines to learn and improve from experience without explicitly programmed automatically. We know that whenever in statistics, we follow certain algorithms. So those algorithms are programmed. Even in normal computer, when you type something, you create an Excel sheet, it is programmed. So on that basis of that program, the computer functions, that particular parameters it identifies. In machine learning, it is the machine is tuned or instructed to develop this programming of their own. Just take I'm citing a simple, very crude example, it may sound though. Suppose we leave this room for lunch. Some people amongst us would go straight to the lunch. Some people would take a break and go to the washroom. So if entire data is presented the computer, it will try to analyze and see who are the people who are going to the washroom and who are going directly for lunch. Then it will find out certain odd figures, maybe the elderly people are going, younger people are going, or something of that kind, those who are sitting for a long time, and it will program its functions and decide that from the next time onwards, it will identify that who will go to the washroom and who will go straight to for lunch. There is another subset which is called deep learning, which is more refined, where the artificial intelligence teaches the computers to process data in a way which is inspired by the human brain. We all know that we will only go to washroom if we need to relieve ourselves. So that thing is human mind. If we want to program it within the computer to realize that these are the persons who would like to relieve themselves and therefore they should be guided to the washroom, then it becomes an exclusively exquisite form of artificial intelligence, which is called deep learning. Much of this deep learning is still in the research phase, and most of the things that we get delivered, the continuous glucose monitoring, the ECG monitoring, etc., which are available today, belong to the machine learning, where the program that the machine is using, the computer is using, is being programmed, but not to the extent of deep learning, which involves neural network. I will show a few examples. So machine learning is how a computer system develops its own intelligence by given those facts. Now this is one big thing, that more you give data, the more will be the correctness. If you don't have the data related to certain groups of people, certain colors, certain ethical, certain languages, then again, whatever its inference will be created will be based upon the data which has been presented. So 1950s to 80s showed a general growth of artificial intelligence, where the computer programming, the softwares, they were the primary impetus, they were the primary sources in which the structures were improved. Then came the machine learning in the 80s to the early 2000s, where the computer became intelligent enough to program on its own based upon the inputs, and the deep learning came after 2010, where the computer or the machines, they are able to, or they are made to think like human beings in a way by this complex neural networks. So there are certain other finer things we will not be, honestly speaking, we will not be able to understand unless and until we do a lot of exercise on computer science and all. But I am just telling you, in machine learning, there are three facts. One is supervised learning, unsupervised learning, reinforcement learning. Simply, it means that if we give some images of CT head to the computer, say 1,000 images, and label them. This is the tumor, this is the trauma, this is subarachnoid hemorrhage, this is fractured base of skull. The computer, based upon its inputs that it gets, ultimately develops its own memory and tries to put, the next time when you don't label a picture, it will itself find out, based upon whatever it has got, that whether it fits into any of these categories. So this is supervised learning. Unsupervised learning is something where you give alternately. Sometimes you give a diagnose, sometimes you give don't diagnose. That is not an ideal thing, but that is most practical thing, because sometimes there may be some wrong diagnosis. You don't want that wrong diagnosis should go to the computer and it should affect his intelligence development. So sometimes you are giving diagnosis, sometimes you are not giving. That is unsupervised learning. And reinforcement learning is based upon his intelligence. You measure what kind of cases you have not given and then try to give only those cases. Suppose you have only given tumor at a time, he understood all about tumor, then you started giving a mix of tumor and vascular, so like that. Deep learning is much more complicated, and out of these four, only convoluted neural network and recurrent neural network, little bit of application they have found so far in medical, and rest of the thing is all theoretical. Now, two more things are strong artificial intelligence and weak artificial intelligence. By strong, I don't mean that powerful or able to do anything. Most of what we consider as strong is again in the paper. It has not manifested, and most of artificial intelligence that we see or find in medical practice today is weak. But weak does not mean weak. And there are importance, all your Alexa, Siri, Disha, they are all weak intelligence. They follow the customers that you type 1 if you want to know about railway inquiry, type 2 if you running status, etc. So all these are examples of weak. Whereas strong AI systems are the ones which are directly performed by the humans, like vehicle driving, robotic surgery, etc. So these are, some of it are advanced or something between strong and weak, but real strong and the super AI is still under the research. Now, if you see these scopes, that all of these systems have scopes either in diagnosing and detecting disease, clinical data analysis, predicting treatment procedures, and precision medicine, because with the development of the omics, the genomics, proteomics, metabolomics, everything is individualized, and precision medicine is finding a big place in healthcare, and therefore it is becoming absolutely important to use the AI to guide us towards precision medicine. Similarly, the robots and the robotic process, the expert systems, and the natural language processing, these four categories of AI have definite role and indication for applications in healthcare. So these are the areas where it has been applied: drug development, disease diagnostics, analysis of health plans, health monitoring, digital consultation, surgical treatment, managing medical data, personalized and medical treatment. In drug development, there are all forms, from design, polypharmacy, repurposing, drug screening. Everywhere it is the area where the maximum use of AI has taken place so far. You remember that this is the first in-human study which has been entirely devised by AI, and this drug is an end-to-end artificial intelligence platform, and it took nearly 7.5 years to fulfill all the different stages from input to human clinical studies to develop this medicine. In disease diagnostics, we have seen that the area where maximum AI has focused is the tumor or the oncology, and also in neurodegenerative conditions like Alzheimer's and Parkinson's. The breast cancer, which causes millions of deaths annually, has been a particularly an area of focus because it has a good prognosis if diagnosed early. And it has been found that there are certain algorithms based upon machine learning which, when applied to diagnose breast cancer, achieved almost 99% accuracy, and therefore those patients got the maximum benefit in terms of treatment. This was another lung cancer, where detecting lung cancer on strokes based on CT scans, assessing the risk of sudden cardiac death based upon ECG and cardiac MRIs, identifying skin images, finding indicators of diabetic retinopathy on eye images. These are the 4 areas on which AI has worked and work is still going on. In diabetes, I would particularly refer to the continuous glucose monitoring, which started in 2005 and which was patented by FDA in 2016, in which cloud-based technology was devised based upon the inputs that we are getting to decide, and it found that the duration of both hypoglycemic time and the control of HbA1c had been better with this artificial intelligence system. In analysis of health plans, one of the biggest concerns we know is the claims data in the US and the insurance, because insurance is also facing hiccups periodically in our country in terms of trying to see what is genuine and what is fraud. So, this AI can actually automate these tasks. This multitasking can be reduced, and all this data entry, claims processing, and appointment schedule can be taken care of by an intelligent computer without any human interface. This has been proven, and it has been shown that it will affect all the social determinants of health and also the patient care parameters like admission, discharge, and transfer. So this will have immense advantage to the insurance industry, as well as it will help people also have more faith in the system once they can see all these processes transforming from one phase to the next phase in front of their eyes. So timely intervention, reduced hospitalization, improved patient outcome, and data-driven insights, which are the most essential parameters of health monitoring over a period of time, can be taken care of by AI, and has significantly been affected by AI. If you see the AI-driven remote monitoring device which are applied now, patient can stay at a distant place and contact his physician and give him those parameters which otherwise a physician won't have access to by listening to or by doing video call. Those very fine parameters, you can take your mobile and show, see, this is the setting on the ventilator, this is the oxygenation, this is the heart rate, but those things would not mean to him just by looking at the mobile, but those can be converted, translated, and given in a very crisp and compatible categorical manner by the AI. So digital consultation, we have chatbots now, both non-human and non-judgmental, which allows patient to feel more comfortable to share those informations of mental health and etc. And they are all part of digital consultation now. So whenever you type, you get something, and it keeps on answering you the question, and those devices can be seen by the patient, by the physician at a later stage, and then it will be able to judge whether this patient is right for. So these are the simple methods which people have been showing, and it has been found to be useful. In surgical treatment, you have seen that localization and mapping, perception, and all those system modeling and control has been adhered to, and they have found control in the presence of robot or other kinds of AI. And surgical robot, preoperative planning, intraoperative guidance, they are all guided by machines, including mapping or localizing the brain functions before resecting certain areas, etc. There are certain ethical and legal issues, but a lot more is expected. It may generate a lot of more confusion in the ethical in the days to come. In diabetes, particularly in prediction of diabetes, it has been found to play a good role because it amalgamates all those data which are there, because in diabetes, it is very essential to identify all those pre-diabetic people who are going to develop diabetes in the next 5 to 10 years early. And this can be significantly assisted by this component of the AI. Glycemic control, I have told. Prediction of complications like nephropathy, retinopathy, CVS events, I have told. And the diagnosis of complications by both advanced learning and machine learning is possible and is being used. Personalized treatment convert traditional medicine to stratified medicine based upon propensity, and the risks to precision has already been dwelt upon, and it is further progressing. The polygenic risk scores which were adhered to by using, because all AI is about statistics. Earlier, what we used to get by doing logistic regression, we are getting much better results applying AI. So this genetic predisposition, continuous monitoring can all be attained better by combining the insights. But there are certain ethical and legal issues, and these ethical and legal issues are a matter of concern, not just for us, but globally, because whenever there is data and that people are exposed to that data, if there can be any chance they can use to manipulate things, is something which we are worried about. Now, Satya Nadella had said that AI is perhaps the most transformational technology of our time. So did Tim Cook in a different way. And the Google Health also wants to empower doctors with AI so that they can meet the need of the patients in a better way. There are both pros and cons, because although it is there are better data-driven decisions which can create time-saving duties, which can reduce unnecessary hospital visits, both important from patient's perspective as for the physician's perspective. But there are concerns which are primarily about privacy and security, high capital investment, although that is relative, lack of interoperability, because many of us who are we have crossed our age to learn new things may find initial difficulties. But all said and done, we have to understand that artificial intelligence is being used in healthcare for answering questions, for assisting surgeries, creating drugs, and there is enormous volume of health data is being generated nowadays, and all this data can be processed, stored, and applied for AI to use the best knowledge with high fidelity simulations and the nursing assistants, and to reduce dosage reduction. So this is the process that we had created system, and it got patent from the government of Australia. So we created it, means our team created it by combining all the data that we had in GB Panth for the past 15 years. So the septic shock patient, the trauma patient, so what are the kind of, so based upon the inputs we give, the ventilator, this system can find out which patient will need how much fluid, which patient will need which inotrope, whether it will need NORAD, whether vasopressin will be required. So everything can be predictable, so that when anybody who is new to this system deals with it, he will automatically get this guidance from the AI to help him out. Although this has not come into the market, we are in communication with the industry, so probably it will going to launch in Australia very soon. Thank you very much for your patient hearing, and thanks once again to the Howrah Town Diabetes Society for giving me this opportunity for being here.
Thank you, Professor Anirban. Any question from the floor?
Hello. Anirban, my question is it legal, actually, if you just use it in diagnosing a patient or for, say, the treatment of the patient, is it legal? Because it is legal to the court of law if you just misdiagnose it with the help of the artificial intelligence.
Yes, good question. So in data, you can remove all those data which are particularly related to the name, address, sex. So you stick to the only male, female. What is the heart rate? What is the presentation? What are the ECG changes? What is the tropi status? How long the patient? What is the procal values? So those serial values which actually matter to the concern without afflicting. So that much only we have used from our system.
So, Dr. Anirban, does it leads to overdoing of the things? Use of artificial intelligence?
In?
Use of AI, does it leads to overdoing things?
A very important concern, sir. It may lead to, whether it leads to overdoing things. I think at the end of the day, we need to have a human mind has to determine that how much, where and how to overdo and not to overdo, because it will give a lead, but ultimately the saddle has to be in our hand to at least refraining from overdoing.
Such a beautiful talk. I think we are enlightened because it's a new thing and we have to know many more things. I think Dr. Anirban has enlightened many more points which we were not aware of. Thank you so much. Thank you so much.
Thank you, sir. Thank you very much.
One more question, sir. I think, do you think that everything will be in our hand? But what you said, that Ajib, the domain is there, and we are the chief controller. I am afraid a huge part of this thing will be out of our hand. The
It is
physicians
very difficult to say how much will be in our hand, how much it will be not in our hand, what will be the, because a lot of this deep learning is still under research. Whatever we have achieved, the benefits is on from machine learning. And deep learning is one step above machine learning. So it is something we are imagining that it will be tremendously benefit. But if certainly this machine starts to diagnose, treat, cure and everything, then how, like desk people are scared that they will lose their desk jobs. What will happen if it tries to identify any HbA1c as a more than 8 as a diabetic and pushes insulin? So these are the concerns, because too much of intelligence can be deleterious. So how much of it, we don't know. But as long as it is help there to guide us, we can follow it. Thank you.
Thank you so much, Speaker Sir. I would request you to kindly stay back. I would request the chairpersons to felicitate Dr. Thank you, Speaker Sir, for sharing your insights. Thank you, chairpersons, for chairing this session.